The two most common questions I get today are, what the heck is a pediatric chiropractor? What do you do? What is that all about? And also, what is the perfect storm? And the reason I'm getting those two questions is because, one, we're getting the word out about pediatric chiropractic and specifically about our specialty, the perfect storm, which may be something you haven't heard of. The perfect storm is about the impact and transformational changes pediatric chiropractic can make in your family's life, especially if your child is struggling with chronic challenges like autism, ADHD, epilepsy, autoimmune stuff that affects their gut and immune system, pandas, POTS, you name it. The perfect storm will explain what's really going on and what the root cause really is, and how long ago the trouble really began to brew in your kiddo's body, in their brain and nervous system. Now, first thing I want to say in this short video on the perfect storm is that this is not something you're going to hear about in your pediatrician's office, in a medical specialist's office, because the entire focus of the perfect storm is to find and address the root causes of these challenges. Not just deal with the symptoms, not just cover up the symptoms and say, oh, hey, you did this survey, now your kid has ADHD, take this medication. Oh, you did this survey, now your kid has this, take this medication. That's really the business of medicine. And pediatricians and medical doctors are phenomenal at crisis care. They're really life-saving, but they're not really great at health restoration and rebuilding. And that is exactly what a child who's dealing with chronic health challenges needs. They need an expert in rebuilding. If you've ever taken on, say, a house rehab or remodel project, then you know that anyone who is good at rehabbing homes or remodeling is going to take it all the way down to the studs. They're going to bring it all the way back down to the foundation and really build it back up from there. And that's what the perfect storm teaches parents, that those foundational challenges or those original instigating challenges or stressors for kids with sensory processing disorder, seizures, autism, and anything in between happened long before they got the diagnosis. So here's the perfect storm in rapid form. In 60 to 70% of case histories we take on kiddos, we find that there was a significant amount of stress on mom's nervous system while trying to get pregnant, so fertility struggles, or during pregnancy. And an early onset of stress for mom is an early onset of stress for baby because of the umbilical cord. The umbilical cord is the power cord, it's the neurological cord, it's the electrical cord. There's now tons of research linking stress during pregnancy to health challenges later on for kids. And we live in this super stressful world where we don't support moms enough and we don't empower them. So that stress starts to form during that baby's brain formative stages. And that early adaptation, that early shift to the sympathetic fight or flight response, we now know starts even in utero for these kiddos who are dealing with these challenges later on in life. And the next step in the perfect storm is really the big focus of our work and what we're trying to get the education, awareness, and action steps about what to do about it out to the world. And it's all about birth interventions. C-section, forceps, vacuum, induction, all commonly used interventions in the medical system that have taken over labor and delivery. And oftentimes with those interventions, they can be very traumatic and often are to the brainstem, vagus nerve, the skull area, this upper neck area, which are really important areas that babies can't control or protect on their own at that stage. And so when that part of the neck is injured during birth trauma, the nervous system again shifts into fight or flight dominance. And when kiddos have these two gigantic stressors so early on during those formative brain stages where the central nervous system is extremely plastic, extremely moldable to the environment and to the experiences that it has, then it's going to hardwire their system and determine how it responds to things later on. And so what that looks like in an outward response for a baby is colic, reflux, constipation, difficulty nursing, and down the road when they're 4, 5, 6 months, it can be recurrent ear infections, croup, RSV, which then leads to antibiotics and corticosteroids, which suppress the immune system. And all those medications given to those tiny little ones early on, especially if they get antibiotics or Tylenol in the first 1 to 3 years of life, really greatly increases the risk of gut and autoimmune challenges later on in life because it's all connected. The nervous system, brain, spinal cord, gut, immune system, it's all connected for development later on. And the third thing we see the perfect storm disrupt is motor development. So nerves control muscles. And so if the nervous system is stressed out, then those muscles get really tight. They get really wound up, especially in the neck and the torso. And that affects things like tummy time, crawling, rolling, walking, and later talking, socialization, behavioral and emotional regulation things. And so motor development is controlled by the central nervous system and brain development. So it all comes back to those beginning stressors. And we've got to find out two things. One, did your child have those stressors early on? And two, if they did it indeed shift their nervous system into a sympathetic fight or flight state, which is the same thing as saying that their rest and digest development system is not developed, it's not active, and that's the vagus nerve and parasympathetic system. So a child out of balance at age 2 or 3 might get a sensory processing diagnosis or spectrum challenges or speech apraxia, things like that. And then a child later on might get an ADHD diagnosis or anxiety. And here's what medicine does to really cover up the sequence and the root cause of the perfect storm, is they just call it something else as it progresses. But what we see is that colicky baby oftentimes turns into that sensory processing kiddo because their neurology and their physiology is still the same as it was during those early formative brain stages. And that's until somebody comes into your life and can do something about it. And that's exactly what pediatric chiropractic does. We do two things to help kids get out of and get through the perfect storm. Number one is to find it and measure it. And so we dive into a really deep case history, and in 50 to 60% of the cases, we find that pregnancy stress, probably a little bit more now with fertility challenges. And in 90% of the cases, we see the birth intervention trauma, and it's probably tipping over that 90% these days. And second, we have this incredible piece of technology that can measure, quantify, and locate this sympathetic fight or flight stress. It's called subluxation in your child's brain, body, and nervous system. So if you think the perfect storm is exactly what your child went through, and you've already exhausted everything medically, every therapy, every detox, every diet change, every supplement, every essential oil, and you're still looking for hope, answers, and help, then you'll find that with a neurologically focused, trained chiropractor. And if this is the answer you've been looking for, please reach out. Give us a call, go to our website, send us a DM. We'd love to help. Thanks for watching, and we'll see you in the next one.